Hello, everyone. Welcome to the second episode of our two-part webinar series titled The Intersection of Traditional Medicine and Behavioral Health in the Latinx Community. This second and final part of the series is titled Understanding Latino Cultural Health Behaviors and the Role of Women. My name is Maxine Henry, the co-director for the National Hispanic and Latino Addiction Technology Transfer Center. I will be your host for today's webinar. Before I introduce you to today's guest presenters, here are some brief instructions about today's webinar. This webinar will be recorded and archived for future playback. That recording will be dubbed or closed captioned in Spanish and eventually also in Portuguese. A copy of today's presentation will also be made available after the webinar. This will also be a great opportunity for you to join our Juntos network to receive information about future events. The lines will be muted throughout the presentation so as to minimize background noise and other interference. When we get to the Q&A portion of our webinar, you will have an opportunity to ask questions by clicking the Q&A box, and I will present your questions to the presenter. We will also be asking you to fill out a brief survey at the end of this webinar. This satisfaction evaluation is important to the work we do, and it provides us the opportunity to improve our training efforts. Although we did not secure continuing education credits for this event, we plan to do so for future events. Certificates of completion will be made available upon request. So let's begin. Next slide, please. Let us start by introducing the National Hispanic and Latino Addiction Technology Transfer Center and our team. The National Hispanic and Latino Addiction Technology Transfer Center is housed at the National Latino Behavioral Health Association located in New Mexico. NALBA was established to fill a need for a unified national voice for Latino populations in the behavioral health arena, and to bring attention to the great disparities that exist in areas of access, utilization, practice-based research, and adequately trained personnel. The NALBA's executive director is Fred Sandoval. Our ATTC is part of the ATTC network, which is an international, multidisciplinary resource for professionals in the addictions treatment and recovery services field. Next slide, please. Established in 1993 by the Substance Abuse and Mental Health Services Administration, or SAMHSA, the ATTC network is comprised of 10 domestic regional centers, 6 international HIV centers funded by PEPFAR, 2 national focus area centers, and a network coordinating office. Together, the network serves the 50 U.S. states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, and the Pacific Islands of Guam, American Samoa, Palau, the Marshall Islands, Micronesia, and the Marina Islands. The international HIV ATTCs serve Vietnam, Southeast Asia, South Africa, and Ukraine. Here you will see a map of the U.S.-based ATTCs. The National Hispanic and Latino ATTC has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Next slide, please. Our ATTC is staffed by Dr. Pierluigi Mancini, our project director, and myself, Maxine Henry, the project co-director. The National Latino Behavioral Health Association is also the home of our sister TTC, the National Hispanic and Latino Prevention Technology Transfer Center. We will provide contact information at the end of this webinar. Next slide, please. Our esteemed presenters for today are Dina Cruz and Socorro Chacon. Dina Cruz is a longtime resident of Boyle Heights and a proud alumnus of Cal State LA. She is currently seeking a master's degree in public health. She works as a project coordinator for social model recovery systems to improve the built environment. Dina diligently aims to improve her community through advocacy and building partnerships with those who can help minimize tobacco, alcohol, and drug-related harms. She has been focusing on parks and barriers to park use, as well as increasing civic participation. Recently, she has received her crime prevention through environmental design designation, which complements her background in art. She currently also serves in the Hollenbeck Park Advisory Board and the Boyle Heights Neighborhood Council. Socorro Gutierrez Chacon is the community liaison for Community-Centered Emergency Room Project, CCERP, a program of social model recovery systems. Since 1999, she has worked to prevent alcohol-related problems in Orange County and Los Angeles County by utilizing community-based strategies. She has extensive experience in community organizing and community building. Her expertise includes collecting and analyzing community data regarding risk and protective factors, developing prevention presentations and trainings, engaging community members in civic participation, and mobilizing neighbors to prevent and/or reduce alcohol and other drug-related problems in high-risk communities. Thank you, Dina and Socorro, for being willing to present for us today. We are excited to learn about this very interesting and valuable topic. Please feel free to take it away.
Thank you so much for having us and for giving us the opportunity to share our experiences working with the Latino population in addressing alcohol and other drug-related problems, including prescribed and over-the-counter medication. I just want to say that we're not an expert on medical field, but our experience is based on what we have learned from other experiences. Our agency, Social Model Recovery System, is a nonprofit organization providing substance abuse, mental health, drug-free, transitional living, and prevention services. Since 1986, Social Model Recovery System has been providing services to individuals facing addictions in Los Angeles County and Orange County, California. SMRS Education Department provide trainings and consultation services designed for participants learn about addiction behaviors, anger management, relapse prevention, trauma and addiction, as well as treatment for addicts with mental illness. Additionally, Social Model Recovery System, to reach the goal of social rehabilitation, integrate prevention programs, since the environment played a big role in a person's rehabilitation and social determinants of health. Prevention programs' mission is to engage the most vulnerable population to challenge conditions and social discrepancies that threaten a healthy environment. Basically, to change conditions in the places where people live or work.
So again, this is Tina. Hi, everybody. Thank you for having us. As Socorro was sharing a little bit about social model recovery systems and the Community Center Emergency Room Project, I wanted to give you a little bit of a background of the work that we've been doing and why we started looking into culture and the role of women and in our prevention work. But first, shout out to the Los Angeles County Department of Public Health. They fund all of our research, and the Substance Abuse Prevention and Control Department particularly, and have tasked us to work in the beautiful city of Boyle Heights. And I'd like to give you a little background on our what we've been tasked with. In 2013, we were asked to look at LACUSC Medical Center, who serves as a lifeline for the entire community, particularly our homeless neighbors who are utilizing it to meet basic social needs for showers, for food, not just for medical needs. So in 2013, we were tasked to finding out how can we better assist our homeless population. And then we realized that the built environment, the environment is playing an important role, not just in not meeting the needs of our homeless neighbors, but sustaining addiction. And so then we were tasked to look at the environment. And to look at the environment, we had to work with community members who were interested in improving the community. And that's how we began going out to the community, to getting to know our neighbors and to ask them what were some of the issues that were plaguing the community, what's keeping us down in Boyle Heights. Later on in the presentation, I will share a little bit more background onto who Boyle Heights is, but definitely I wanted to share a little bit of our background into why we got involved in prevention and working in the communities, and particularly with the women in Boyle Heights.
Thank you, Dina. And also, social model recovery system believes that changing communities and create healthy environment is critical and possible. Therefore, we engage community members once again to address alcohol and other drug-related problems and to improve the quality of life in their neighborhoods. Furthermore, the residents' participation is critical, and our work with residents have helped us to put attention on activities and objectives towards their needs. Over years, the public health model practice have contributed in developing and analyzing the characteristics that distinguish community-based preventions from other forms of actions. Public health model approach to prevention aims to improve the lives of people who are affected by drugs or drug policies, focusing on population's health, safety, and in addressing changes in the social and physical environment, and most important, including community participation. Again, prevention is not focused on changing individuals. It includes input from diverse sectors, including social services, justice, policy, and the stakeholders to address problems. The public health approach is a three-step process that can be applied to any problems that affect population, like the agent to make it fit in today's topics could be prescriptions and over-the-counter medication. Host may be the customer, the person that misuses the medication, the person that shares the medications, and the environment could be the local pharmacies, the availability, social context, culture, low-income communities. And also, the culture plays a very important role. This provides important social and economic benefits, improving learning and health, increase tolerance and opportunities to come together with others. Culture enhances our quality of life and increases overall well-being for both individuals and communities. Some communities may be defined by common beliefs or ideologies, like religion or political views, by race or ethnicity, by socioeconomic status, etc. The community we work in, Boyle Heights, we take an important consideration on how the culture influences issues. Boyle Heights have a good number of Hispanic families, being first generations in the United States.
So culture is so dynamic, and that is why we wanted to better understand the invisible beliefs, the invisible things that are impacting how we reach health, how we seek health. And we wanted to see how that impacts use and misuse of medication. And shortly you will be able to be part of contributing to finding that information, as there will be a polling question. But I wanted to give a little bit more background about culture and context matter. Ethnic and generational differences give credence to respondents' culture and characteristics and context. That's why we needed to see and hear from the community. Differences in behavioral patterns amongst generational and ethnic subgroups of the population further validate the need for culturally grounded, practice-based evidence research, as well as prevention and intervention techniques that align with the person's culture and context. And that's kind of what we wanted to get at when we started hearing in the community that this was something that was percolating. The use and misuse of medication, the sharing of remedies, all of this we're going to talk a little later that percolated, but we began early on to notice that culture and the way our community, particularly here in Boyle Heights, is predominantly Latino, was starting to seek health that was driven by culture. So this is so important, especially for Latinos. And as we continue the conversation, I want everybody to keep in mind that culture can be a protective factor. It can maybe sometimes cause us to do things that maybe other cultures don't think is good for health. But culture, again, can be seen as a protective factor, and that's the focus that we wanted to take. But we also heard a little bit about how there are some practices that maybe some other people maybe demonize, and we're going to be talking a little bit later about that. So stay tuned.
So for us working with this population, it is not enough to know the magnitude of a public problem. It is important for us to understand what factors protect people or put them at risk. Why are risk and protective factors useful? And we need to identify where prevention efforts need to be focused.
Oh, we get to that part where you get to be part of this. We want to hear from you. There is a polling question here. Do you agree or disagree with the following statement? Is it okay to take more than the recommended dosage of a prescription medication if you are feeling more pain than usual? Let us know what you think. Do you strongly agree, disagree, or strongly disagree?
Thank you so much for taking your time and answering the question. And this same question was discussed while we were having community group discussions, while delivering prescription drug presentations to our coalition members, community groups, and parents from different schools within Los Angeles Unified School District, aimed to increase their knowledge on the importance to take prescription drugs the way the doctor prescribed it, not taking prescription drugs that are not prescribed to you, and prescription drugs can be addictive and cause death if used in the wrong way. All the information gathered led to deeper conversations because we find out that they believe that prescription drugs were not addictive, that it was safe to use them without a doctor's permission or authorization, getting it from the comadre, from the friend, from other family members, because they are legal and widely available. Prescription drug abuse is only an adult problem, and they believe that the prescription drugs by themselves, it was not a problem. So we decided to have a focus group and address all these myths about prescription drugs. So we had our first group with existing coalition members to learn more about what they were sharing medication, why they were not seeking doctor advices, and preferred to consult a pharmacist. At the same time, the Los Angeles County Department of Public Health conducted a community needs assessment report on prescription medication misuse and public perception in Los Angeles. The findings showed that prescription medication is the second to marijuana as the most commonly misused drugs in the United States, with about 6.8% of adults misusing RX medication. There was other information for what reason have people misuse prescription medication, and at 36% were saying to relax. And they were asking how easy it will be for someone to get prescription medication on the street around your neighborhood, and it was 68% saying that it was too easy. So we feel like we need to more about this in the community we work. So we schedule additional focus group now, including men 55 to 59 years old, women ages 25 to 59, youth ages 14 to 17, seniors ages 16 and over, and transitional age youth 18 to 24. The ethnicity of the participants was determined by what the participants reported of their heritage and typical food. The methodology and questions for focus group were designed in collaboration with Loyola Marymount University. We conducted a total of 5 focus groups. So I'm going to let Dina to talk more about what did we do this, the data analysis, process, and funding.
Hi, thank you, Socorro. So I also want to mention a little bit, I want us to keep a small timeline in the back of our minds. Mind you, this is 2000, we started working on this in 2016, right? And in 2017 is when we wanted to know more, and we developed the additional focus group. But at the same time, the nation was dealing with the opioid crisis, and we're still dealing with the opioid crisis. And so the county survey that Socorro was mentioning, it's important to note that county-wide surveyed nearly 10,000 residents throughout the county. And as we know, the East Coast is heavily hit with the opioid crisis, but it's a little bit slower on the West side. And so we also kept that in mind, and we wanted to know, okay, we want to make sure things don't get terrible here, right? As prevention specialists, we're looking at prevention. We're trying to see, hey, what's keeping us from having lower numbers, right? But at the same time, we want to know, how do we make sure that this doesn't get worse, and how do we help other people who are dealing with this opioid crisis? So this was a topic that the County of Los Angeles, it was at the top of their priority list. So we were like, okay, we're tasked with this. We know that this crisis is happening. We want to find answers, but we never lost sight of the most important thing. We are serving a predominantly Latino community, and we wanted to know what is keeping our community safe, what is causing our community to engage in risk. And so we kept that in mind. And as we were wrapping up the initial survey with our coalition members, which you can see in the picture here, these are the fabulous pioneers of our coalition who participated in the initial survey. And in the initial survey, we wanted to know, based on the conversations that Socorro mentioned that were happening during our presentations, where we were trying to address the misuse and abuse of medication in the community, the questions began to percolate, and stories about sharing and how children are being put on medication because, they have maybe behavioral issues. But women are like, oh, my child's just hyper, but the doctors, the teachers, they want to put them on medication. We started hearing these stories all the time. And we felt the responsibility to look at how do we help our Latina sisters and who are dealing with these issues. And what we found actually from the original focus group was that there was a tremendous preference with Mexican medication over US. The initial participants in the focus group said that they had a preference for Mexican medication, not only for medical needs, but also for dentistry. Now, a little bit of context as to our community, right? We're in LA, and we are about 3 hours away from TJ. And not only do I, as a Latina, and I know Socorro, we practice this, but we heard this from our members and our participants in the focus group, that, we got a friend that's going to TJ, guess what? We know to put our order in bright and early because we want to make sure we get the good stuff from TJ.
Yeah.
It's not just a cost-effective way to get medicine, but it's almost like there is a tremendous preference. In our focus group, in our original focus group, one of the participants said, well, you get the cough medicine here from the U.S., but it's just water with sugar. Now, if you want the good stuff, you order it from TJ. Like, that's like, okay, wow, there is this perception that Mexican medication is better, it's potent. So we had a lot of questions. And so in 2017, when we started looking at the additional focus group that included the community at large, keep in mind the first focus group was our members that were participating in community presentations, that were part of our coalition. Now we open the surveys, the focus group to the community at large. And we wanted to get a little bit of all the groups. We started with the youth ages 14 to 17. Those were the ages that participated in our focus group. And why is age important? Well, we wanted to gain a better understanding of how culture and worldviews and community context influence risk, availability, accessibility, and consumption of prescription medication, of course, and over the counter. We also wanted to see if this belief that Mexican medication is better, or the remedies that we're practicing at home are carrying over to the second and third generations. We were curious. We wanted to know if these youngsters who were born here or were acculturated here, if they were still carrying on that torch. So we had those questions for the youth. And then we wanted to use our findings to develop culturally responsive prevention strategies for RX and OTC use and misuse. I gotta tell you, I have a lot to share with you today. I'm really excited. I'm gonna share a little bit more about those recommendations later on as we wrap up, but stay tuned for those. But what I wanna share about the youth is the youth were very knowledgeable. They were knowledgeable about OTC medications, and they were starting to gain kind of a sense of like, I know what I need to do, I know what I can get, but not without involving mom. They did mention that they always involve mom. They always checked in with mom. They wanted to know if the caldo with the big rub, well, you know, they knew about that. They were sharing stories about how they are able to get this OTC medication, whether they have a headache or a cold, but they always check in with mom.
And it was incredible how the Big Vaporu, it was good and well recommended, but the mothers or abuelas to cure anything.
Yes, and I know we've seen a lot of jokes about that, but it's real. It's a real deal for us. And then now we moved on to TAY, the transitional age group. These were the 18 to 24-year-olds. They were the group that we surveyed, that we did the focus group with. They shared that they were in college, and it was the first time that they were attaining their own sense of, I'm providing my health care, I'm more responsible for taking care of my health, and that they were really grateful for the students' health centers that were now able to reach a higher level of care. And with that higher level of care, they were able to access more resources, but they did mention that they always checked in with mom to see if that was the best course. If there was an alternative, if what the doctor prescribed was correct. So again, this recurring theme of mom kept percolating, kept coming up. And so we were intrigued. And as we moved to the men, let me tell you, the men was exciting. Was my favorite focus group because it validated a lot of things that we know are real, but it was nice to hear it from a male perspective. The men shared that although times have changed, they are still faced with expected machismo-driven gender roles. They are the providers, and health is not a priority for them. They think that if they take care of themselves, based on what they share with us at the focus group, if they take care of themselves, they're taking away from what they could be giving to their family. But they did acknowledge that the women, and then for the men, they mentioned all women, particularly mothers, but they mentioned sisters and wives. They mentioned that if it wasn't for them, they would not be seeking help with health. They wait till it's an emergency. If I'm not bleeding, if I don't feel like I'm dying, I'm not gonna go to the doctor. These were the stories that they were sharing. If I don't see blood or if I can walk, I'm still gonna go to work. But the women were driving their health, and then the moms were making care packages for them. Even though these were grown men, moms were preparing care packages for them. And again, the TJ trips, they mentioned that they would let their family know, I'm going to TJ, and they would have the bags ready for them to bring over. So it's very exciting to hear them and to hear that shout out and the acknowledgement of the women and how important women are for them. And this group was the only group that mentioned legal status, they did mention that that was preventing them from reaching health. None of the focus groups mentioned mental health or disabilities or how they address those. And I think that was something that we missed in our focus group because those are topics that are taboo in our community still. But this is something for the future that we want to look into. Now, with the seniors were very interesting. The seniors were very interested. They said, you know what, I have to choose between paying my rent and getting my medicine. How powerful is that? They're saying, you know what, if I have to choose between paying a bill or getting my medication, I'm going to pay my bill. And then the other thing they were saying is mortality. They feel like I'm almost ending in my life, and so I'm gonna kind of like just stick with what I know. I'm gonna stick with the U.S. doctors and whatever my doctor prescribed. They seemed a little bit less attached with the use of Mexican medication. After the focus group closed, they did share that they do like to drink their tequila with lemon when they have a cough. They did share that, which I thought was really interesting. But the pied de resistance, the highlight, the main important thing when we got to the women's focus group, I can't wait to share with you what that yielded. The women's focus group deserves special attention because already, mind you, this was building up all along, right? We know that women are so important, the Latino women, right? The role that they play. And so we're going to get to that. But shortly, you will be able to participate a little bit more in the polling. Here's another polling question, so you get to be part of this. Do you prefer medicine from the U.S. or from your native country? U.S., native country, or not sure? Okay, so here we have the polling results. 55% prefer U.S., and then 18% from their native country, and 27% not sure. Okay.
Interesting.
Very interesting. Health-seeking behaviors. Here we have the recurring theme where we mentioned briefly about the preferred Mexican medication over U.S. And we talked already about how the health-seeking behaviors are driven per age group, and how we found most importantly that the women were the gatekeepers of health, and we want to focus a little bit more about that. Here is another polling question. From whom do you seek health advice from? U.S. doctors, doctors from my native country, community doctors, other U.S. healthcare professionals, other healthcare professionals from my native country, friends, or family members? Okay, from whom do you seek health advice from? 63% of you noted that you seek advice from U.S. doctors, 5% from doctors from your native country, community doctors was 8%, U.S. healthcare professionals was 9%, other 2%, friends 3%, and 9% would be family. Those are very interesting results.
And it's funny how still the friends and family got some percentage on this question.
Now, the pied de resistance, the women, the gatekeepers of health, the pillars in the Latino community for health. The most exciting thing that we found from the women was that they had a wealth of knowledge. I mean, we could have had that focus group for 3 hours and it wouldn't have been enough. The women had so much to share. They were sharing recipes, remedies, but what was really important was that they were well aware of what we had or heard from the other groups. They were well aware. They said, you know what? I am the doctor. I am the doctor. I must have the answer. I know that I have to be ready for when something happens to my family. If somebody's sick, I need to have that answer. That was really powerful. They were aware of that, and they were very tenacious. They knew that the internet was available to them as a resource. They also knew that they had to have alternatives for them. This is where we started hearing about the complementary and alternative medicine options that they were providing to the family. But they mentioned another thing that we thought was really interesting. They explained a little bit as to why they prefer Mexican medication and Mexican healthcare, seeking Mexican healthcare, because they felt that the doctors from another country have more heart and empathy. They felt that here in the U.S., when you go to the doctor, you're just another number. You're just another patient. They felt that even when you go to the pharmacy in their native country, they could get that one-on-one care, that investment in their health, that they even had mini consultations with the pharmacy. And if you didn't have money, the pharmacy was a line of defense. And later on, we're going to talk a little bit about the first lines of defense for seeking health. But this was very interesting that the women had this to share, and that they were conscious of their role as the pillars of health.
I just want to add that at the Women's Focus Group, we find out that one of the reasons that they go to the pharmacies instead of emergency rooms, it was the language. And they were also going to see botanicas that we're going to talk a little bit more, is that all the employees speak Spanish. Therefore, our community feel more connected and better understood of what they are feeling and what they are looking for.
And as we are talking about community, I did promise to give you a snapshot of what Boyle Heights is. And mind you, these answers were for predominantly a community that's 94% Latino. We are only 6.2 square miles. That's a very tiny city, but we are densely populated. We have 100,000 residents in Boyle Heights, and 94% are Latinos. Of those 100,000 residents, 52.4% are foreign-born. So this is really powerful because we know that this community relies heavily, and it's also, Boyle Heights is rich and has a history of welcoming all communities and of activism. And when we talk about welcoming communities, I know when we talk about Mexico, and we think just Mexico, right? But Mexico is so big. It's as big as the U.S. And they have so many states. And all those little states from El DF to Oaxaca, Puebla, Michoacán, they all come together in Boyle Heights. So we have a rich cultural background from several Mexican states. And so this is very important to note that this was important for this community. This is something that's really gonna drive their health. This is something that's really, if we can tap into how important culture and the demographics of the communities that we serve and how to better tailor health access and prevention initiatives to tailor to those communities and respect the cultural component of them. We were hearing that, sometimes we do have beliefs. There are religious that are, we believe in susto. I don't know if many of you know what susto is, but susto is, it's what a doctor would say, post-traumatic stress disorder, right? But for us, we can link it to diabetes. If you get susto, hey, you're prone to have diabetes if you got susto. We do believe in that. And so
don't drink water after you got a susto.
She always tells me, don't drink water if you had a little scare because, you're going to get diabetes. And I know it can seem funny, but it's real, and we believe in this. And so we want healthcare providers and we want prevention specialists to acknowledge that realness. We believe in mal ojo, the evil eye. I mean, these things are real and they're real to us and they really impact our health. And so, so it's important to look at this in the particular communities where we work. The community and the cultures that we serve is so important for us to develop those strategies of whether it's to seek help or to prevent something from happening. So as we talked about the complementary and alternative medicine that was percolating during the focus group with the women had a lot to share. I know I mentioned that they shared about the remedies. Two things that stood out to me were the use of breast milk was big, and not just the use of breast milk, but sharing the breast milk. If you know you have a mama that has a newborn, that's the best milk, and we know that, right? And so if you trust that person that's breastfeeding, they would be comfortable asking for that milk to treat infections of the eyes. They mentioned infections of the ear and the eye where they use the breast milk. And we know that can be risky because of the things that can be transmitted through breast milk. But this is something real that's happening. We really do. My sister, I personally self-disclosed, when I had my son born, I had two of her friends, because they felt that they could trust me, that I didn't have anything, they asked me for my milk to get treatment.
It's even, some people share that they use it for small burns.
For small burns. And the use of urine to treat fungus infections, that was big. They were mentioning how urine can help treat fungus in the toes, and particularly the younger the child, the cleaner the urine is. And so if you could get a baby urine to treat your fungus, that's the best treatment. They also shared remedies on weight loss. Canela tea, which is cinnamon tea, was a big one. One of the participants shared that she had lost 20 pounds drinking cinnamon tea. And so all those recipes and remedies were really exciting to hear.
They were sharing that blending the Mexican cactus, nopales, with grapefruit and drink it in the morning for 9 days. It will help you to reduce the fatty in your body.
The fatty in your body, that's funny. So I want to talk a little bit now about the recommendations. And before we move to the next slide, we're going to talk about botanicals. But first I want to talk about the recommendations. We know that based on our findings, we really advocate for interventions that target women. If the women are the gatekeepers of health and the women are the pillars in the family, then interventions to protect and to help people reach health should be tailored to women and target the women, particularly Latino women, since in 2050, we're going to be 30% of the U.S. population is going to be comprised of Latinos. We are a very powerful force, and to overlook our health and wellness, it can really have a negative impact if we don't look at how Latinos, how large Latinos are, how much we represent in the U.S. And the other recommendation is that healthcare providers could help their Latino patients reach higher levels of care if they acknowledge that there are cultural beliefs and a preference to CAM, complementary and alternative medicine. Therefore, doctors should know the common remedies that we use, and if there could be a potential conflict to a medication that they prescribe. It could be rare, but it's possible. For example, Socorro mentioned nopales. Nopales are a staple for the Mexican diet. They are delicious, and they grow easily in dry areas. So nopal is a staple, and we know this. And but if a patient is taking blood regulation medication, then nopales can have an adverse effect. So if a doctor is serving a particular population where nopales is a staple of the diet, the doctor needs to know and be aware of this potential adverse side effect. Although rare, this is kind of like acknowledging and respecting the culture that the community that they serve. And advocacy, I can't stress how important advocacy is from the community and healthcare providers, not just the healthcare providers, but the community. We need to advocate for our resources to be available to address even the topics that are stigmatized, such as mental health illnesses and disabilities. This is something that we don't talk about. This is something that we're not advocating for. There are resources available, and the community may not be aware of those resources or how to reach the Latino population to ensure that they are partaking from the resources available. So the goal is to move our community from averting emergencies. We don't want it to be like, I'm going to wait till I'm like dying to get help, but rather to embrace prevention and intervention and getting the ongoing healthcare that we need.
And for those not familiar with what is a botanica, these are small shops that sell herbs and traditional remedies, candles, and other items used for religious or rituales purposes. They are very famous in this community. Like Dina mentioned it before, we are a small community, only 6.2 square miles, and we have 10 botanicas and only 6 pharmacies. And again, like I said it earlier, is they are very famous because if one of the women shared with us, if I go to the botanicas and I said, I have an ear infection, but I put the cigarro on my ear and I put Vicks, Vaporub, they not being judged. If they go to the doctor said, what are you talking about? So they feel shame. They don't feel shame going to the botanicas. Plus, again, the language barrier is a big factor for what the people go to the botanicas in our community.
Yes, botanicas were identified as the pillars of health in the community, just like the pharmacy, just like the women mentioned that the pharmacy in their countries were the first line of defense. For some of the participants, it was the botanicas here that were the first line of defense. And so, and I know that a lot of people demonize these places, but they are actually places where you can get help. And if we can begin to embrace them, and maybe they are not, we do know that they do provide maybe medicine that has the like the penicillina. You know, you can get it at the mercadito. You know, you can get it at the botanica. But perhaps if we develop those relationships and help them to understand that you know, provide safe services to the community. You are important. You are valued. Please help us help our community. That's part of our next steps of what we're working on. We're trying to work with local healthcare providers to acknowledge complementary and alternative medicine, to acknowledge that the patients are going to the botanicas. And on our level, at the built environment level, the environment itself, we're looking at the botanicas and how can we help them better serve the community so that they know that you know, they are important and they are needed. But we want them to be good operators. And how do you stop operating in the shadows and you know, get that knowledge that they need if we are not acknowledging their importance?
So I would say that our residents, participants, people living in Boyle Heights, being first generation, they have a deep connection to their beliefs and culture. Another factor is that not having health insurance was mentioned as a reason for why they go to botanicas, since these are less expensive. They got a quick appointment. They just show up, walk in, and got whatever they needed. And instead of spending hours in emergency room or trying to schedule an appointment with a doctor, they can get 2 or 3 pills instead of buying the whole bottle. So unfortunately, this increased the use of to alternative medicine and in getting likely medical attention. Our Latino culture, I include myself since I'm Mexicana, our beliefs are strong, and we are proud of the knowledge we get from our ancestors to care for our family. Medication is not something we will seek first. We tried alternative medicine, home remedy, we seek for family advice, and we trust our mothers or abuelas' advices. Definitely, first generation of Latinos, we are attached to home remedies, and it is something we carry with pride. Culture played a big role in our healthcare. Every culture has beliefs about health, disease, treatment, and healthcare providers. In California, according with recent studies in 2017, there were more than 2,000 overdose deaths involving opioids, a rate of 5.3 deaths per 100,000 persons. The main driver of drug overdose deaths was those involving prescription opioids, with more than 1,000 deaths in 2017. So the need to address prescribed medication opioids is critical. And I would like to add it that we, Social Model Recovery System, will be having a California Community Opioid Conference, No One More Death, in November 2019. You can visit our website, socialmodel.com, for more information, or we can send an email. We save the date to all, and once agenda is ready. Thank you. Thank you so much for your attention. Hoping the information we share help in having a better understanding of how culture and community context influence risk, availability, accessibility, and consumption of prescription and over-the-counter medication for the Latino community from the east side of Los Angeles. And hopefully you were able to identify how age and gender specify culture influences on the use and misuse of prescribed medication.
Thank you.
Thank you, ladies. Can we put up the next slide, please? We'll just have that there for a moment. Perfect. So now we've come to the Q&A portion of our webinar. What I'll do is I will take some of these questions and I'll read them out loud. Our goal is to get to all of the questions, but in the event that we don't, we work with both of the presenters, and make sure that we put updated follow-up on our website. And as you will see here, our website is www.nlbha.org. So stay tuned there for more information post the live events for any kind of follow-up. All right, ladies. First question comes from Jerry Theo. He wanted to know, did the focus group address issues of racism, oppression, racial inequity, lack of access to services, and non-consideration of traditional medicine?
That is a great question. I'm gonna have to say yes and no. And the reason why I'm saying yes and no is because they didn't explicitly use those words. They didn't quite say that, but they did mention the economic, the social determinants of health, the barriers that are keeping them from reaching health, such as financial, like medicine is expensive. Our senior said, hey, I have to choose between paying the rent and getting my medication. Guess what I'm gonna do? So in a way, they were acknowledging that socioeconomic conditions are impacting how they seek health and medicine, but not explicitly. We did not purposely try to gauge that, but we know that it's there, and we know that it affects them.
Okay. When you speak about YAT or TAY or transition age youth, can you expand on that a little bit more? What ages were you talking about?
We opened it up to the public for ages 12 to 17. Thank you. We forgot to mention a little background on that. So when we decided to open the focus groups to the community at large, we opened it up to youth ages 12 to 17, and the transitional age group were 18 to 24-year-olds. And the way we did that is we actually created a flyer. We went to the youth centers, the local Boys and Girls Club, the College Track Center here in Boyle Heights, which were hubs for youth, and we asked them to help us, interview the youth. And they, the directors were willing and were excited to have us come do the focus group at the local Boys and Girls Club. So we were able to partner with the local Boys and Girls Club, and they actually provided us the space, and they advertised with their youth, and they secure the participants for us. We pretty much just did flyer distribution and talked to the directors, and it was mostly the Boys and Girls Club who helped us.
Great. Thank you for that. So kind of along those same lines, we have two additional questions. One of them is, when you did the focus groups with the men, were they the only participants at that time? Because sometimes, answers can be different if women are in the room or younger people. How did you conduct the focus groups for each one of the different age groups and gender groups that you talked about?
Oh, yes, thank you. So the men's focus group in particular was exclusively men, and it was in a conference room, very private. The way we did it is we recorded the conversations. We had activities for them to place markers where, similar to the polling questions that we had them put a sticker where they would identify or what they would prefer. And then we had those in-depth conversations and probing questions. And it was very intimate. It was my favorite focus group that I participated in. It helped that they were very honest. I believe that they were very honest. I felt that they were eager to share. They had a lot to share, and they were eager to share. And I'll never forget a story about the sobador. I don't know if you're familiar with what a sobador is. It's somebody that fixes your bones or an ailment through massages. And he said, my mom, I have broken my ankle, and my mom took me to the sobador, and I was traumatized. And ever since then, I never gone back because he made it. He felt that he made it worse. So that was another exciting story that they shared. They also they were the only group who shared about the legal barriers of when you don't have documents, how do they seek health, or if they're getting health care. The unique ways that they are looking to achieve health was through that was identified in the focus group. And then the other groups, the youth were at the Boys and Girls Club. The senior and the women's focus group were in our office. We just did the information dissemination to get people to participate. And we were just crossing our fingers that people would show up, and we did. We had the participants show up, and we did it in our office space. So it was a very quiet, intimate setting.
Great. So for the male focus groups, did men run the focus groups or did women?
They were separate. The men.
You mean who was the facilitator?
Yes. Sorry.
Oh, we were the facilitators for all of the focus groups.
Okay. All right. Yeah. So Socorro and Dina were. Okay. Perfect.
Yeah, like I mentioned it, the methodology and the focus group questions were developed at the Loyola Marymount University.
But we were the facilitators.
Yeah, we were the facilitators.
We were the ones doing all the focus groups. So it kind of helped us get really involved because we were the facilitator, and we transcribed everything, all the audio, we transcribed it, and we hope that our findings will get published shortly.
Thank you. So we have a question from two different individuals that's basically on the same topic, from Mara Sammartino and also from Esther Ayers. Both of them had heard that mental health wasn't really brought up in these focus groups, specifically with the men. Was mental health brought up at all by the facilitators in any of these focus groups to help address what's going on in the community with mental health, knowing that it is taboo and there is quite a bit of stigma attached to it?
I would say that it was not mentioned at the focus group. Mental illness is not seen in the Latino community like that is something that they're going to call mental illness, but they talk about depression, nervous, but not exactly as a mental illness. It was not addressed as a mental illness.
I think it was a missed opportunity on our end. If I feel that we didn't think about that, we didn't add it to our questions, and it was brought up, like Socorro said, but it wasn't as like a priority to talk. They didn't bring it up as much as if we were intentionally trying to gain that information. I think that was a missed opportunity on our end, because we know that these are subjects that are not particularly talked about. They are still taboo. What autism? I've even heard from our community, autism doesn't even exist. So it's just, like, I know the older generation has, like, just give him a good spank and he'll get fixed. We've heard that from the community, right? We know that
a little denial.
We know that, and we didn't purposely try to probe or ask, and I think that was a missed opportunity, because we know that that's a health barrier. We are not reaching the higher levels of care that we should be. We are not talking about, we think we have our diets that are not necessarily the healthiest, right? And we have so many issues that we need to address. And that was a missed opportunity, especially since we know that our community does deal with all of those issues. We have particularly, we didn't talk about how the barriers to reaching services when you're dealing with a mental health issue, or when you have a disability, and we know that that's happening, but we didn't particularly touch on the subject, and it was a shame that we didn't.
Thank you for that answer. So along those same lines, you all, Boyle Heights, as you had mentioned a few times, ladies, is a much smaller area as far as, like, I think you said 6.2 square miles. Do you know where people in the community are seeking mental health services, if they are seeking them?
That's a good question. We have mapped our community resources in Boyle Heights. That's another thing that we did to kind of help our homeless neighbors, as we were originally tasked with. We're trying to find resources for our homeless neighbors. And so one of the things that we did is we mapped the community resources, and we found that we have some a lot of places that provide services. We have the Wellness Center, we have the Women's Center, and we have the Botanicas, where, when they are seeking help from there, but particularly those resources are available. We don't quite know how the community or to what extent they are utilizing those resources, but we do have resources in the community. We have two major hospitals. We have Altamed here. We have a lot of clinics and nonprofits, but I don't know how much the community is utilizing those resources.
Because the first impression before they talk about mental illness, they talk about brujeria.
Yeah, that's another thing, that when you talk about maybe something's wrong with me that I can't explain, somebody must have done something to me. That did come up, but and I know that I personally, like, I like think about it. I personally do think of it. I'm like, oh, maybe somebody's wishing me harm, when maybe I'm just having stress or anxiety. But as far as the resources, no, we don't know to what extent it's being utilized.
Right. Okay. Did you all in your focus groups at all, one of the participants, Annabelle, mentioned that addictions are oftentimes also not seen as illnesses or as a symptom of mental health issues. Did the topic of, I know that you all talked about some of these prescription medications not being seen as addictive, but was there any conversation in any of the age or gender groups about addiction to substances?
The youth did mention that they are well aware of the marijuana use. It was the topic that they did talk about, and how they know how to cure your eyes from being red, and that you can get eye drops at the 99-cent store, at the liquor store. They're like at the front counter. and so they're dealing with their friends or themselves smoking marijuana and the side effect of their eyes being red and how to treat that themselves. They did mention that. They mentioned stress a lot. They mentioned that homework and the stress of homework is they are aware that they can take Tylenol and they know that they can get it and they will get it. Addiction, as far as like marijuana, was the one that most came up.
And the other one was the Adderall, that it was very popular at college level, because even that is prescribed for hyperactivities on kids at elementary school. College tell us that they use it to be more focused on while final exams.
Thank you. So Jeffrey Arrington wants to know if you are aware of any peer-reviewed research on the efficacy of human urine for the treatment of athletes' foot, and for that matter, any other treatments. Do you know if it has been peer-reviewed, if there's any kind of evaluative research on that?
We didn't get that far, but it sounds like that would be an excellent thing to add in our to-dos. Aside from us going to do environmental scans and additional interviews, we will definitely add that to our lit review. I know that there's a lot of researchers that are looking into how to help Latinos reach health and acknowledging the culture, but for the particular remedies that the participants identified, we did not look at lit reviews for peer or research articles that were supporting or negating that.
Thank you. That would be a very interesting
review. Thank you.
Right?
Question. That's really definitely help us expand.
Absolutely. All right. So Manuel Medina said that he appreciates the examples of cultural defined symptoms and practices, and wonders if there's a repository of cultural symptoms and practices, susto, mal de ojo, etc. Do you know if there's like a
I don't know if I understand the question.
He was wondering if there is a place where we can go where some of these symptoms and practices for traditional medicine specifically are housed. Can he find this online somewhere or in his community somewhere?
Oh, well, for our community in particular, we know that for those things, not necessarily going to the curandero, but the botanicas will be the next step. If you are dealing with something like susto, there's also maldojo, the empacho. I mean, I know that there are the señoras that somebody who knows how to fix it. But as far as like other than the curanderismo, I know that you mentioned that there was a class on curanderismo, but on the community would probably be the botanicas where you can reach help. And if they cannot help you, they will probably be the one to refer you to the doña or the lady who knows how to fix it.
And actually, we have a coalition member that promote that he knows how to do that.
Yeah, he does the sobador. He does the healing of the bones and all that, and the chakras, and so it's more of like for seeking that help. It's more of like just reaching out to the community because the knowledge is there. It's word of mouth. It's knowing who you know, but also if you reach a place where you can't get that help, maybe just look into the botanica. I know it may seem scary at first, or maybe you may have religious conflicts, but maybe just so that you can get a second opinion, or maybe they point you to a tea. It could be as little as maybe doing a aromatherapy. It could be as simple as that. It will not necessarily involve a ritual, but I would say just talk to people because the knowledge is out there in the community.
Great, thank you. And it's kind of something that we've done for generations, right? We
Yes.
rely very heavily on those that we trust and that we know. It really does take a village. Um, Alex Santos said this. He's not sure if he understood. Are the community pharmacists allowed to sell prescription medication or medicine even though the community members do not have the doctor's prescriptions? Or are they simply selling?
That's a wonderful question. We actually know for a fact that yes, we know for a fact that pharmacists are providing medication without prescription, not just because we've heard it from community members, but because both of us have tried to get medication at a pharmacy without a prescription, and we were able to get it. So it is happening, especially if the pharmacist, maybe, there is that cultural, like, oh, I know this will help you, let me help you. I know that it is illegal. We know that the DEA, we work closely with the DEA actually, especially when we were looking at the botanicas and how can we help them be better, serve the community at a higher level, right? We wanted to know, we want to protect them. We don't want to criminalize them. We support them. We think that they are helping people reach health. So we wanted to make sure, how do we help them be great operators, be great, be out in the light, not in the shadows, right? So when we were working with the DA, we know that that's not good. We know that that's not allowed. We know that that's bad, but that's happening. It is, you could try it. I don't recommend it, but most likely, especially if you're in a Latino community, there's a chance that you may be able to get your medication at a pharmacy without a prescription.
While I went to one of the pharmacies, I asked the pharmacist if the doctor was there, and he said no. And what do you need? And I said, well, I'm having this coughing. I have tried everything, and I'm still can't sleep. And he said, okay, I can give you this, but you need a prescribed medication. And I said, well, I don't have time. And he said, okay, you can get it, but I'm not going to give you a receipt, and I'm going to remove the price and the name of the pharmacies. So that's how easy it is to get prescribed medication in local pharmacies, unfortunately.
And the one that I got was antibiotics. I just walked in. I told the pharmacy, I think I have a UTI. I don't feel good. I don't have time to go to the doctor, and I really need some antibiotics. And the lady at the counter, I don't know if she was a nurse or a pharmacist or not, but she was at the pharmacy counter. She said, I think I can help you. She went to the back. She talked to the person in the back, and she came back with a little bottle of antibiotics. She goes, here you go. And then she gave me some OTC to go with it, and so it was really easy. It's unfortunate because we know that can have risks, and but it is happening.
Well, it's good to know, though, that you all aren't just testing it out, or that you're just taking the word for it, but that you're also working with these botanicas and with lawmakers.
Mm-hmm. We want to acknowledge that there's naloxone out there. We want to check if they know that they can provide it without a prescription. We want to know how much is this happening in that community, because we don't want it to happen. We know that has risks. But we don't want to criminalize anybody. We want to know what information needs to be provided and provide it.
Great, thank you. Yeah, and that you're working with lawmakers to make sure that what you said is that they're better operators, and that they're doing things that are above board. And like you said, it not only helps to support these local businesses, but it also helps keep the entire community safer. And so, thank you all for taking that extra step. Another question, did issues around faith and church and the role that might play in seeking healthcare come up, or was that addressed at all in these focus groups?
Oh, that's a good question. No, not explicitly. No, the participants did not say, I don't finish my treatment because, I'm going to put it in the hands of God. I know that when we did our lit review, there were some researchers that did look into that, because religious beliefs sometimes, particularly in Latino community and the Catholic Latino, there is this, I'm going to put it in the hands of God, And, you know, particularly with patients who are dealing with HIV, Latino patients. I know that there was a article on Latino patients seeking, not adhering to their HIV treatment for many reasons, but one of them was religion. It's like, I'm gonna put it in the hands of God and God will make work for me. But at the focus groups, that didn't come out. We didn't ask that explicitly, and it didn't come out that much in the conversations. It was like a complete religious did not come up. It was not even. It didn't even talk about it.
Perfect. Okay. It's interesting, right? Because it's such a big part of a lot of Latino communities. And so sometimes it's just kind of like, well, of course they're involved, you know, or whatever. It's just a little bit more, sometimes more obvious for us, so we don't always talk about it out loud. Another question specific to this research. While we know that this specific set of focus groups was done in Boyle Heights, and there is a larger concentration of Mexican heritage in this Latino population, was there any conversation about any other heritage groups and also the multi-generational groups?
We did track that in our we had a little confidential where they would just share, you know, what country or what community they identify with, and we had a couple people from El Salvador, and it was mostly just Mexican and Salvadorian. And what was the second part of the question?
We know that you worked with different age groups. You had multi-generational groups. But did these focus groups at all talk about the differences that they see in other generations?
What they did talk about was that they did mention the access to the information through the internet. All women, youth, and Tay mentioned that they are well aware that they can look at information and verify their sources, but that they still believe in what mom says. They still believe in you know what's happening at home and that closeness at home, particularly with the female role. So I think it was something that was, the generational piece was there because we see the change in technology, and we know that they were not as comfortable with it. Was a little bit more prying with the youth. We did have to probe more with them because they were, I think it was also the recording. Once the recording stopped, they opened up a little bit more with examples. So I do think that there is some, it is being carried over, but it is not as strong.
Okay. So Jerry Theo mentioned that in his work with men over the last 40 years or so, or at least his organization's work, that while Latinas have a major role in getting men to seek help, oftentimes it's other men, such as their friends or their compadres or their family members who are males, who will have a bigger impact on whether or not they determine to change their behaviors or, for instance, to improve their behaviors. Did any of that conversation at all come up in your focus groups?
I would say no.
No.
Because when they did mention seeking help, they were very clear that if it's not an emergency, they were not going to get help. They did mention that the only reason why they are going to their annual checkups is because of pressure from the women. But I did notice in the room kind of a camaraderie among them when they were talking. It was something more visual, more like that we saw. They're like, yeah, and then they would feed off of each other's answer a little bit. Like if one answered, then he would then share a story that complemented the neighbor. We did see that, but particularly was an acknowledgement towards the women, not how other men influence their seeking health or achieving health.
And I will say that accept that they were seeking for medications or doctors' advices. It was being like, I would say that a macho man would not accept that he needs go to the doctor or that he's sick. It's some kind of, I would say that like a denial among them and accepting that they need to go to the doctor. It's being seen like a weakness among them.
Okay.
This is how they self-identified as, like, I know that what I'm saying is machismo. I know that what I'm saying is not maybe accepted in this time and in this time, but guess what? This is what I subscribe to. So it was something like that.
Okay. Jill Plevin asked, when you were talking about the senior focus group, did you say that they felt like they were at the end of their life, so they stuck more with Western medicine or with the medical care from their native culture?
That is correct. They did say that, I'm reaching my end, and I don't know if I want to risk, an opinion from someone from not the U.S. I prefer U.S. Healthcare, is what they said.
So there was that shift.
Yes, there was that shift.
Okay.
And I don't know if it was the fact that some of them maybe cannot go back to their country, because some of them did disclose that they were undocumented, or that they really, I'm reaching my end, and Western medicine is better, and I'm going to stick with it.
And they very knowledgeable about remedies and the getting over-the-counter medication, but they prefer not to at that age.
Yes. They did just say that.
Okay.
More cautious, more conservative.
Okay. There was another question along the same lines. Are the young adults using traditional medicine more than the first generation? Or did you not see a difference in that?
It was like a mixture, because they were saying, I'm finally responsible for my health. I'm finally, first time I get to manage my own healthcare as I go to the student health center. But they did still mention that they will check with mom, especially if it's a stomach ache, especially if it was like things like a headache or stomach ache. They were able to like assess. They were kind of alluding to that they know when to seek the Western health component, and then they know when to seek mom. And for mom, it was more of like, I have a stomach ache and she gives me mint tea, or she has the herbs growing in her yard, so she'll just prepare something for me. So I would say it's a mixture.
Okay.
I think they are carrying it, but they are also knowing that they are beginning to be independent.
Okay.
And what they have access to is Western medication and Western health access to healthcare.
So they're getting it from both sides.
Mm-hmm.
Family, the traditional stuff from their family, and then from the Western practices. So Cynthia said that in New Mexico, Medicaid provides monies for alternative medicine. Is this done in California?
Oh, not that I know of. In Mexico, you can. New Mexico's included in the Medicaid.
So yeah, New Mexico does allow for value-added services, which allows you to see a traditional healer, or to go to a sweat lodge or temazcal, and to practice, your traditional healing. Do you know if this is allowed through Medicaid or supported by Medicaid in California?
I don't know, but I'm intrigued, and I will look into it, because I personally want to know if this is included or not.
Yeah, it's a great thing. Thank you for bringing that up, Cynthia. All right, it looks like we have time for one more question. Malcolm Harris wants to know, is the core population being encouraged to incorporate traditional medicine with the more science-based medicine?
Is the core population?
The population that you are working with, are they having conversation at all about them using both traditional medicine and Western medicine?
Yes, those conversations are happening. What the overall consensus was, I'm gonna make with what I have. There are limitations, and they are like, this is what we have, and I'm going to embrace it. But if I could have it all, I would have, my healthcare be like it is, like the one I'm getting in my native country. As far as like, when we're talking about native country, we're talking about Mexico. But they are accepting that this is what they're dealt with, and they are seeking the complementary and alternatives, but from like more of like a grassroots, like from like they're getting it from what is passed down to them, what the comadre might know, and that network of information that's in the community.
Great. Yeah. And so maybe even having those more open discussions, both with community members and with providers, so that it is easier to have these conversations if you're using both, especially if there might be any type of counter effects of an herb with a medication. Did that come up at all?
No, that didn't come up at all during the focus group, but we did look into it afterwards, especially because at one point we were subscribing to the, those, I rather be holistic and organic, and nature knows best, and mother knows best. But upon further research, it looks like there are some you have to be informed. It's not that it's bad; you have to be informed. For example, Socorro shared with me about ruda, and what she told me was, if you're pregnant, you shouldn't have ruda because it can stimulate an abortion. And like, okay, I don't want that if I'm trying to conceive, So having that knowledge is important. But some of it is very rare. I think they're mild, but there are some side effects that we need to be informed, and our providers need to be informed of.
Exactly. Perfect. Noreen Kelly wanted to thank you all for talking about the cultural treatment and also how Natives are using their traditional treatments. She comes from a Native American community, and she agreed that they too don't recognize mental health as an illness, but instead as an attention to someone's thought process and the fact that they might be in need of a blessing and an herb cleansing. So again, I think that the work that you all are doing is really helping to honor these generational traditions that we have, but still finding ways to inform people, inform community organizations and the providers that can help to enrich people's health. So thank you for all of the amazing work that you are doing in the community. Just to let everybody know, we do have a few more questions that we didn't get to, but like I said, we will be taking all of these questions, and we'll work with the presenters offline to get as many of these questions answered, and we will put them up on our website, www.nalaba.org. There you will see all of the contact information. Want to thank Dina and Socorro for your presentation today and for all of the invaluable work that you are doing for our communities. This slide here shows you the contact information. The previous slide showed you the contact information for the National Hispanic and Latino ATTC. Please reach out to us for more information about our projects and to request training and technical assistance. On the next slide, you will see the contact information for Social Model Recovery and for Socorro and Dina. As a reminder, a recording of this webinar and the PowerPoint presentation will be made available in the upcoming days. And most importantly, we would really like to ask each one of you to take the next couple of minutes to fill out our satisfaction evaluation. This information is really important to us. I promise you, we do look at it. We do everything that we can to improve our events. And we're always looking for ideas for additional training events and webinars. Thank you for everything that you do, and thank you for joining our webinar, Understanding Latino Cultural Health Behaviors and the Role of Women. We hope everybody has a wonderful day.